Robert Bache, Medicare Bob, owner of Senior Healthcare Direct, and in this video I'm going to share with you the 2019 updates to Medicare prescription drug plans, how they work and when you can enroll. So first let's go over how a drug plan works. Most drug plans have 4 levels. The first level is called the Deductible Level. The second level is called the Initial Coverage or Copay Level. The third level is the Coverage Gap or Donut Hole. Big changes to that for 2019, so stay tuned. And the level 4 is what is called Catastrophic Level or Catastrophic Coverage Level. So let's go over the changes to level 1, the deductible. The standard deductible for 2019 is $415. Now, a lot of plans in 2019 have what's called a tiered deductible. So what is a tiered deductible? Well, you're going to look at plans that have a $415 deductible. And when we hear the word deductible, we think, oh, okay, I'm going to have to meet that $415 before the plan pays anything. Well, in 2019, a lot of plans have a tiered deductible, which means tier 1 and tier 2 medications, which are going to be your preferred and non-preferred generic meds, are going to be exempted from the deductible. So you'll have a low copay right from the start. So the change for 2019 is the deductible is increasing to $415, but there's even more plans that are having that as a tiered deductible where tier 1 and tier 2 drugs do not apply to that, so you have a low copay for those drugs right away. Level 2 for 2019 is going to be in between your $415 deductible, so once that's paid, and $3,820. Now, while you're in this level, you're going to pay 25% copays for all of your prescriptions. So your plan will pay 75% and you'll only have a 25% copay for your prescriptions. Now, it's important to understand that each drug plan has a different formulary, list of covered drugs, and they also have different negotiated amounts for each prescription. So that's why it's important to shop your drug plan, because one plan, it might cost them, let's just say, $100 for a particular prescription, and another plan might be able to negotiate and get that for $80. Well, you're going to pay 25% of what they get that drug for. So if they're paying $100, you're going to pay $25 copay. If they're paying $80, and you're going to pay 25% of the $80. So that's why it's important to shop, because you're going to pay 25% of whatever they negotiate for that prescription for you on the plan. So the level 2, the copay level, during this level in 2019, the plan's going to pay 75% and you're going to pay a 25% copay for your prescriptions. Now, once your cost and the drug company's cost equals $5,100, you're going to enter what's called the coverage gap, or commonly known as the donut hole. Now, a lot of us, if you follow me, you know that we've been talking about how MACRA passed a couple years ago, which meant that the donut hole was going to go away in 2020. That's what we've kind of heard a lot about, and if you're active online, you know about. Good news, the Congress passed a bipartisan budget act of 2019 that's going to actually get rid of the donut hole for brand name drugs starting in 2019. So normally you'd have to pay a higher copay for your brand name drugs once you enter the coverage gap or donut hole, but starting in 2019, you no longer have to do that. So even while you're in the donut hole, you're still only going to have to pay 25% for your brand name drugs. Now, while you're in the donut hole, you will have to pay 37% of your generic, so the donut hole still applies to generic drugs. But as you and I both know, most generics are pretty cheap and affordable, so paying 37% of those is not really a huge deal. That's still affordable for most people. Now, so big news there. In 2019, the donut hole is gone for brand name drugs. Okay, so you'll still only have to pay 25% of your drug costs for brand names. You'll still pay 37% for generics, but again, that's usually not a big deal. Now, once you guys enter to the catastrophic level, okay, Medicare is actually going to step in and pay 95% of your prescriptions, and you'll pay 5%, whether it's a generic or a brand name. Catastrophic level is going to be very affordable for you. The plan's going to take most of the bulk of the costs. They're going to pay 95%. So while you're in level 4, you'll just pay 5%. I know I went over a lot here. There's a chart behind me. If you have any questions at all, just leave a comment below, and I'm happy to help answer any questions you have regarding drug plans. I'm also going to be doing another video, if you look at our Facebook or website, YouTube, on how to find the most cost-effective drug plan in 2019. So stay tuned for that. I'll try to put a link to that on the bottom of this video so you can easily get to that. and then my office can show you how we get the most cost-effective Part D plans for 2019. So if you have any questions about prescription drug plans, just leave a comment below. I know some people have questions, what is a formulary? Real quick, I'll kind of go over that. A formulary is a list of covered prescriptions. What is step therapy? Step therapy for 2019 means that if you're taking a really expensive prescription, your plan can require you to try one or two less expensive drugs first. So that's something you want to keep an eye out on. Quantity limits, you want to make sure you have an eye out on quantity limits. And also while you're looking for a drug plan, take a look at prior authorizations, especially if you're taking any of like the painkillers, like what's considered narcotic. Some plans in 2019 are going to have prior authorizations for those, meaning you have to get a note from your doctor stating that you really need it. So they might do that before they'll cover that. So while you're looking at a drug plan, make sure you check to see if any of your prescriptions are requiring prior authorization, quantity limits, or step therapy. So if you have any other questions about 2019 drug plans, just leave a comment below and we'll be happy to help.